nawr gan lefarwyr.
Questions now from the party spokespeople. Conservative spokesperson. Questions to be answered by the Minister for Mental Health and Wellbeing and to be asked by James Evans.
Diolch, Presiding Officer. Minister, given the Royal College of Psychiatrists' recent report, Weight Management and Mental Health Framework, it highlights the current Welsh weight management strategies, such as A Healthy Weight, Healthy Wales, offer no tailored guidance for people with mental health conditions, despite their elevated obesity rates, nearly 26% versus 16% of the general population. So will you commit today to updating national guidelines, guidance and guidelines so that mental health services in Wales receive specific direction they need to support healthy weight alongside wellbeing and mental health support?
Thank you so much for raising this, James Evans. This is something that, as you said, and as the Royal College of Psychiatrists highlight, is that, you know, when you're having support for mental health, sometimes that really does impact your weight and your relationship sometimes with food as well. And so I think that it's really important that you've highlighted this today. It's not something that I would be able to make a commitment to at this moment. And that's because, as I've already said today, we do everything in Welsh Government, of course, with our stakeholders in a co-produced way. So I'm so pleased that the Royal College of Psychiatrists has done this assessment and this report, because they do so many of these across lots of different areas for us in Welsh Government. And then it's an excellent start to actually go about addressing this. But they would have taken this from lived experience. And so if this is what it's calling for, then I agree with you. This is something that needs to be addressed.
Thank you. It's a bit of a shame you can't give us any assurances today, Minister, but I'm going to push you a little bit on this if I can, because the Royal College of Psychiatrists framework also made clear there is no current standard in place requiring regular medication reviews or annual physical health checks for people who are prescribed with medications. And as you said, that's something really important because it does affect people's relationship with food, and there has been that link made between significant weight gain and people who are on antidepressants and different types of medication. The gap in monitoring the risk is compounding as well. People with existing health conditions, and I think that's something that needs to be looked at, because people who already face poor physical health due to their inequality and their background don't need to have that exacerbated. So I'm just interested, what concrete steps will you do to make sure that these checks are mandated by GPs and by health professionals to make sure that physical health checks are done along with the regular checkups that they're having for their mental health and well-being?
Thank you very much. Again, I think you raise a really important point here. I would say, though, that when it comes to anything to do with prescribing and pharmaceuticals, this is something that will always have to go through, you know, evidence-led, nice guidelines and checks. And also when it comes to what GPs offer and what they can be, as you said, mandated, that's something that has to be negotiated through the GP contract, which again sits for the Cabinet Secretary for Health and Social Care. As you know, we had some great success this year with the new GP contract, which will now see that they have to give annual health checks to people with a learning disability, which I think is great progress and will actually touch on many of the things that you've mentioned today. But again, I won't be able to commit to anything in the chamber today, but this is a really good start to being able to have this discussion as we start to look to the next year.
Thank you. I think I'll leave my notes to one side. I think I go better without them sometimes. But, you know, Carol, it is a bit disappointing you won't give us any assurances today, because a lot of people who fed into this report are going to want some answers as well. Be interested to know what feedback the government is giving to this report as well, to see how we can improve that across Wales. But one thing that was highlighted was the lack of data there is around this area. And it's not the first time that the Welsh Government has been accused as such of not having the reliable data to hand on certain health conditions. So it'd be interesting to know how you're going to improve data in this area. And it's not just from the health side of it as well, it's also working with your colleague, the Cabinet Secretary for Local Government as well, to see how we can get data from there. But one thing I think could really help in this space is actually the involvement of our sports clubs and Sports Wales. So I would like to know how you're working across government to break down those silos, to make sure that if people are taking medication, that there is that support available across government and third sector organisations to help people to have a better relationship with food when they are taking this medication, because we do need to make sure that all people are supported out there, because we do know that when people are taking this medication, it can spike people's weight and it can make their conditions worse, especially people who are suffering with anxiety and different types of mental health conditions, that sometimes you're suffering with that and all of a sudden then you start to suffer with obesity, which can, I said, exacerbate the problem. So I'd like to know what you're doing across that area as well.
Thank you very much. Just to be clear as well, what I can say today, I give you an absolute assurance that I will take this away and we will discuss it across government. It goes against across many of our portfolios. But just to say, like, I absolutely agree with you. I know people with lived experience of this, and it can really knock your confidence at a time when you need to be building yourself up. I would also give you assurance that we will be able to send you my response to that report that you've highlighted today. So this is definitely not me saying that we're doing nothing. This is me committing to doing something now going forward and getting back to you on that. When it comes to mental health data, yeah, this is one of many people have pointed out that we just do not have the same, access to data in mental health in Wales. But we now have the mental health and wellbeing strategy that's come out. We also have the suicide prevention and self-harm strategy, and these are key aspects of addressing everything that you've said there. And then when it comes to working, across the third sector, I mean, he's left, unfortunately, but I wanted to point out that the Minister for Culture, Skills and Social Partnership has now provided funding so that every football club in Wales will be able to access one of around 1,000 mental health awareness training places as part of a drive to better support clubs, to support their teams, coaches and players and their wider community. I've actually learned a tremendous amount through listening to Jack Sargent, the Minister, and what he said about having the right support and being in the right place sometimes where you're willing to kind of say, yeah, you know what, I do need some help. Now, the link that you've made with medication, I think, is really important, because even though we've done an awful lot to reduce stigma of talking about certain mental health issues, I still think that there's a stigma around needing medication for those issues, whether that's short-term or whether that's long-term. I think there's a lot of people who have a fear of that, and I think there's an awful lot more work to do around that. So it plays a huge part in everything that we're doing here. But as you mentioned, this sounds like excellent evidence, but when it comes to things around prescribing, I will have to kind of take this away. But I agree with you. We want to be able to give everyone the support that they can have to absolutely thrive, whether that's with mental health and well-being or whether that's how they feel about themselves physically, because we know that physical and mental and emotional health are so intertwined.